Should girls younger than 17 have easy access to the morning after emergency contraceptive pill? In a controversial move today, the American Academy of Pediatrics said yes to that question.
The organization now recommends that young teens should be prescribed emergency contraceptives to help reduce teen pregnancies. Plan B, the emergency contraceptive advertised to help prevent pregnancy before it happens, is what the American Academy of Pediatrics says in a policy paper should be in teens' reach if Plan A goes wrong, which has many people talking.
The youth needs to know what their options are so they can make a clear decision for themselves.
So I think they need to know more about their sexuality before they are trying to take care of results they don't even know they're going to have.
The policy paper encourages pediatricians to have the conversation of sex with their teen patients and their options for emergency contraceptives like Plan B. Dr. Jamie Lipeles, an OB/GYN at Marina Del Rey Hospital, says making it available to teens doesn't necessarily encourage them to have sex.
It's some people's beliefs that if you discuss this with them, if you provide them with emergency contraception, it'll encourage them to have sex. When in the past studies, it has shown that it does not increase the likelihood of a teen to have sex.
Nearly 80% of teen pregnancies in the U.S. are unintended. Current federal policy bans over-the-counter sales of the morning after pills to girls under 17, but it can be available to teens under 17 by prescription.
And if you make it readily available to them, they're more likely to use it in the time frame that they're supposed to within the 72 hours.
And a teen's privacy is protected by law.
Your parents are not going to find out about this. Nobody knows about it. It doesn't have to really go in your chart.
The authors of the policy paper from the Academy of American Pediatrics also noted that at the policy level, quote, pediatricians should advocate for increased non-prescription access to emergency contraception for teenagers, regardless of age, and for insurance coverage of emergency contraception to reduce cost barriers. The morning after pills are a high dose of regular birth control pills that range in price from $10 to $80. And this is how it works.
Plan B would either stop the egg from coming out of the ovary, so it stops your ovulation. It also stops the sperm from reaching the egg. It stops the sperm from fusing with the egg so that pregnancies don't occur.
It is most effective when they're used within the first 24 hours after unprotected sex. It's also important to note that Plan B is an emergency contraceptive, not a form of birth control.